Hey y'all, welcome back to my channel. Mr. Global here. News, politics, energy. There's something that people have not been talking about at all concerning the big, beautiful budget bill. And I have spent a big part of the day researching this. And that is the impact it's going to have on health insurance premiums for Americans. We've talked a lot about cuts to Medicare and Medicaid and SNAP and all these things. But there's other provisions in the bill that affect the Affordable Care Act directly. And there's also things that are going to affect health insurance premiums indirectly. And I don't know if they are considering all of these things when it comes to the rise in health insurance premiums. So first of all, they're going to allow the enhanced tax credits, which were passed in the American Rescue Plan, to expire at the end of 2025. On average, that is going to increase health insurance premiums purchased through the ACA, through the marketplace, by 75%. Wow. And listen, me and my wife are both self-employed. We purchase health insurance, and our health insurance is astronomical. It's more than our house payment. In many instances, these health insurance premiums will more than double once they let this expire. I read where a 60-year-old couple making $85,000 a year, their annual insurance premium could increase by $15,000 a year. That's how much it increases. That's not how much their premium is. That's how much it goes up. That's well over $1,000 a month. Just increase. In addition to that, it ends offset cost sharing reductions, which will increase specifically silver plans through the marketplace. In addition to that, it completely eliminates a lot of the free programs for low-income individuals for bronze plans. Now, when you take all of that and you take the number of people that are going to be thrown off of Medicare, that number, Medicare and Medicaid both, that number appears to be rising daily. The last figure I saw was 7.8 million people. And honestly, I don't think they really know how many people this is going to impact. I think they're all guessing, to be completely honest with you. So when I give these numbers, these are the latest numbers we're being told, right? So let's say the number is 7.8 million. That's the latest number they came out with. And then you include the cost increases to people on the ACA, to people who purchase health insurance through the marketplace, right? A lot of people are not going to be able to afford their health insurance then. So there's going to be a big loss of insured people through the marketplace when those premiums go up. I know if, the average person, if their health insurance premium goes up by over $1,000 a month, they're either going back and trying to buy an extremely cheap premium or extremely cheap policy, or they're just foregoing health insurance altogether. So with all of these millions of Americans, and we still don't know how many it'll be, losing health insurance, what is that going to do to the cost of health care? What is it going to do to what a doctor's office decides to charge you for a shot, or what an emergency room visit costs? What's going to happen to those things? They're going to go way up, because the percentage of people that are covered and can afford to pay it goes way down. And that means they have to charge the insured people and the insurance companies significantly more. Do you understand what I'm saying? This means that health insurance premiums are going to go up even more because of that, because the healthcare costs are going to go up significantly due to the sheer number of people that are no longer going to be insured and cannot pay. So that means to me it makes common sense that everyone's health insurance premiums are going to go way up because healthcare costs are going to go way up. And then you have people who cannot even afford health insurance now also facing higher healthcare costs to just compound the burden of not being able to afford healthcare insurance to begin with. Mark Warner said this morning that the number of uninsured people in the United States as a percentage, not the number, but as a percentage, will go back to what it was before Obamacare came into effect. Yes. The Congressional Budget Office and an organization called Third Way have both estimated that medical debt in the United States is going to jump by $50 billion because of this piece of legislation. And I live in a rural area in a red state, and I'm surrounded by red states, and there's a problem that we've been having for a very long time that is about to get worse, and that is the closure of rural hospitals. Rural hospitals are going to get hammered by this legislation through the Medicare cuts. And they have already come out and said that they are going to have to compensate for the lack of people who are able to retain health insurance through their healthcare costs. So the rural hospitals are already saying your healthcare costs, just your basic costs, are going to go way up because so many people are going to be uninsured. And all of this is happening because apparently we must give massive tax breaks to the very wealthy. What will they do without another $1 billion? Honestly, I cannot imagine in what universe anyone would think this is a good piece of legislation. I just can't. The political climate in this country today shares striking similarities to those of failed states from the past. Now, I'm not saying the United States is going to become a failed state. I'm not trying to be hyperbolic and I'm not trying to fearmonger. But what I am saying is that the things that we are witnessing today in the United States are things that we have seen in other countries. Now, fortunately, our country has more safeguards in place. And the question is, will those safeguards keep us protected? Will they hold up? We talk about things like mass deportation, huge pieces of legislation designed to benefit a select few people. The loss of public trust, the obvious massive corruption in government. These are all things that we have seen in the past in nations like Venezuela and Haiti. And we're seeing it right here today in the United States of America. There are already organizations that are considering the United States to be a Category B failed state. If we cannot stop what's happening in this country with the defeat of the Republican Party in the midterms, I say all bets are off. All bets are off. And it is unfortunate that we are all going to have to experience the amount of pain that we're going to have to experience for everyone to realize the folly of their ways. I don't know how else to put it. It appears we're going to have to hit rock bottom to truly see what we've done to this country. The problem with that is a lot of people in this country can't survive rock bottom.